privilege to invite His Excellency Prayut Chan-o-cha, Prime Minister of Thailand, to provide some remarks. Your Excellency, you have the floor.
Dr. Tedros Adhanom.
His Excellency Dr. Tedros, Director General of the World Health Organization. Her Excellency Madam Kiva Bain, President of the 73rd session of the World Health Assembly, distinguished delegates and participants. Let me express my appreciation to all participants who have joined in force and spirit to deliberate the various important issues at this 73rd session of the World Health Assembly throughout this past week, especially when it came to enhancing global health security and also the World Health Organization's triple billion targets. This will be crucial tools for us when it comes to tackling COVID-19 as well as tackling emerging infectious diseases. Allow me also to take this opportunity to commend the World Health Organization for its relentless support to member states in responding to COVID-19. The organization should also be applauded for its efforts towards ensuring equitable access to COVID-19 diagnostics, treatment and vaccines through the ACT Accelerator and also the COVAX facility. Thailand has fully supported these approaches from the outset. Distinguished delegates, Thailand was the first country to discover a COVID-19 patient outside of China. Since that time, we have pursued aggressive public health measures. As a result, Thailand has been recognized by the international community as a country that had recovered very quickly from this pandemic. Nevertheless, we very much remain vigilant and are determined to further develop and enhance our capacity to respond to health emergencies. Therefore, Thailand has joined with the WHO Thailand to conduct an intra-action review, IAR in other words, in order to review our COVID-19 response and to learn lessons that will help us to improve further going forward. The main factors for our success have included strengthening the strength of our health system, which includes dedicated health workers and also cooperation from people and all sectors of our society. Now, many countries in the world continue to face a raging pandemic and a second wave. On behalf of the Thai government and the Thai people, I should like to extend our message of encouragement to everyone, everywhere, and reiterate our readiness and solidarity with the international community to fight this pandemic, especially to help build resilience for our health systems and to ensure that treatment and vaccines for COVID-19 are global public goods. Achieving these goals is not possible for one country alone, nor is it possible for the WHO to work in isolation. There is a critical need for all countries and all stakeholders to come together through international cooperation in order to achieve success, because only together we can survive. Finally, I would like to express my best wishes to the Director General of the World Health Organization, to the officials and to all those participating in this World Health Assembly. We wish you good health and we hope that you are safe from all dangers and threats. I thank you.
Thank you, Your Excellency, for those insights and words of support. Now the Director General will deliver his closing remarks. Dr. Tedros, you have the floor.
Thank you. Thank you, Madam President. Your Excellency, General Prayut Chan-o-cha, Prime Minister of the Kingdom of Thailand. Your Excellency Kiva Bain, President of the World Health Assembly. Excellencies, distinguished delegates, dear colleagues and friends. First of all, I would like to convey my deep appreciation to His Excellency, the Prime Minister, for his expression of support for WHO. Thailand is an excellent example that with the whole of government, whole of society, comprehensive approach, this virus can be contained even without a vaccine. Thailand's numbers speak for themselves. Although, as the Prime Minister said, it was the first country outside China to report a case of COVID-19, it has reported less than 4,000 cases and just 60 deaths, with a population of 70 million and one of the world's largest and most crowded cities. This is no accident. 40 years ago, Thailand made a commitment to investing in its public health infrastructure and has made continued investments in strengthening its capacities under the international health regulations. The country's network of more than 1 million village health volunteers, who are the eyes and ears of the health system in communities, played a critical role in the response. Thailand has also learned the lessons of the past, including its experience with SARS in 2003. But Thailand is also learning the lessons of the present by working with WHO's country office to conduct an intra-action review to understand how it can further strengthen its public health defenses. I urge all countries to follow Thailand's lead. No country can say it was well enough prepared for COVID-19 or that it has no lessons to learn. There are many other countries with similar stories to tell. This is no doubt that a vaccine will be a vital tool for controlling the pandemic, and we're encouraged by the preliminary results of clinical trials released this week. Never in history has the vaccine research progressed so quickly. We must apply the same urgency and innovation to ensuring that all countries benefit from this scientific achievement. But we have a long way to go. The world cannot put all its eggs in one basket and neglect the many other tools at our disposal that countries like Thailand have shown are effective for bringing this virus under control. The virus itself has not changed significantly, and nor have the measures needed to stop it. We know what works. First, know your epidemic and do the basics well. Find, isolate, test, and care for cases. Trace and quarantine their contacts. And second, engage and empower communities to protect themselves and others with the full range of measures: physical distance, avoiding crowds, ventilation, hand hygiene, and masks. The COVID-19 pandemic has demonstrated the consequences of chronic underinvestment in public health. This health crisis has ignited a socio-economic crisis that has impacted billions of lives and livelihoods and undermined global stability and solidarity. Returning to the status quo is not an option. We don't just need more investments in public health. We must also rethink how we value health. The time has come for a new narrative that sees health not as a cost, but an investment. That's the foundation of productive, resilient, and stable economies. To start building that narrative, today I'm proud to announce that we're establishing a new Council on the Economics of Health for All to focus on the links between health and sustainable, inclusive, and innovation-led economic growth. The Council will comprise leading economists and health experts and will be chaired by Professor Mariana Mazzucato, Professor of the Economics of Innovation and Public Value at the University of London, and the founding director of the University's Institute for Innovation and Public Purpose. The Council is expected to hold its first virtual session in the coming weeks and will discuss its work plan and mode of operation. The pandemic has also shown that there is an urgent need for a globally agreed system for sharing pathogen materials and clinical samples to facilitate the rapid development of medical countermeasures as global public goods. It can't be based on bilateral agreements, and it can't take years to negotiate. We're proposing a new approach that would include a repository for materials housed by WHO in secure Swiss facility, an agreement that sharing materials into this repository is voluntary, that WHO can facilitate the transfer and use of materials, and a set of criteria under which WHO would distribute them. I would like to thank His Excellency Anutin Charnvirakul, Deputy Prime Minister and Minister of Health of Thailand, and His Excellency Roberto Speranza, Minister of Health of Italy, for their support for this concept and for their willingness to provide materials under this new framework and to be pioneers of this approach. I would also like to thank His Excellency, Federal Councillor Alain Berset, Head of the Federal Department of Home Affairs of Switzerland and the Swiss Confederation, for offering a BS4 lab to support this initiative. Other countries have expressed interest in the idea, which we look forward to discussing with member states alongside other initiatives, including the Universal Health and Preparedness Review and the Council of Economics of Health for All. Excellencies, dear colleagues and friends, I wish to thank all member states for their flexibility, goodwill, and pragmatism in adapting to the constraints of dealing with a large agenda virtually across multiple time zones. I would also like to thank our staff who have worked incredibly hard to make this assembly happen and overcome many technical and logistical challenges, and especially the moderators who managed the flow of interventions and ensured everyone was heard. Despite the challenges, this assembly has been very productive, as you would agree with me. You have approved a comprehensive resolution on emergency preparedness, a new roadmap to defeat meningitis by 2030, a new roadmap for neglected tropical diseases, a resolution on scaled-up action on epilepsy and other neurological disorders, and you declare 2021 as the International Year of Health and Care Workers who deserve our salute. Through a written silence procedures, you have also adapted the immunization agenda 2030, the global strategy to accelerate the elimination of cervical cancer as a public health problem, the global strategy for TB research and innovation, the decade of healthy aging, the global strategy and plan of action on public health, innovation, and intellectual property, and resolutions on eye care and food safety. Each of these represents an urgent health priority that affects the lives of millions of people and which increases the demands on and expectations of WHO. We look forward to working with all member states in the coming weeks and months to build a WHO with increased capabilities and the resources to meet these demands and expectations. We in the Secretariat remain committed to supporting you at all three levels of the organization to deliver on the commitments you have made. And we will continue to implement our transformation agenda to build the modern, agile WHO the world needs. We count it an honor to work for this great organization and to work with you to promote health, keep the world safe, and serve the vulnerable. Together, we're one WHO. I thank you.